Sometimes I think people might think I am drunk because sometimes when I'm walking, I lose my balance or I stumble. I just want to yell, I'm not drunk. I'm just dizzy. Hello, I'm a TBI survivor. Sometimes we just can't walk straight. Dizziness or feeling off balance can happen after a concussion, and symptoms can last for a couple weeks to a lifetime. Symptoms can be persistent, requiring the need of walking support devices such as walking sticks, canes, or walkers. Fatigue, stress, some medications, and alcohol can make symptoms worse. Injuries to your neck, ears, vision, legs, or feet can compound your symptoms. Symptoms can occur when you turn your head too fast or when you try tracking things with your eyes. Places like grocery stores can make symptoms worse because of the bright fluorescent lights and the movement of people around you. Head injury specialists say this is due to sensory overload. Symptoms reported after a concussion can be dizziness, lightheadedness, feeling disoriented, sensation of floating, vertigo, problems with balance, problems with coordination, feeling unsteady, bumping into people or objects, or disequilibrium. Symptoms usually resolve within 6 to 8 weeks after a concussion. When you are dizzy, take it easy. Avoid driving in high-impact exercise until your symptoms resolve. Feeling off balance or dizzy can increase your risk of falls. The last thing you want is to hit your head again or break a bone. If you have any of these symptoms, see your general practitioner first so that they can rule out that your symptoms are not caused by medications, anemia, thyroid disorders, or low blood pressure. Specialists they can refer you to are a neurotherapist, occupational therapist, physical therapist, and a physical medicine and rehab doctor. Neurotherapists will perform a comprehensive exam to see if your dizziness is from the inner ear, such as benign proximal positional vertigo, or from visual tracking issues. They will also evaluate if you need help with walking or balance. And neurotherapists are physical therapists who have trained to help people with injuries to the brain and spinal cord. Their therapies will help treat your dizziness and help you regain your balance. Occupational therapists help you by using everyday activities. They help you maintain and recover function of your daily activities. They can evaluate your balance, coordination, and difficulties with walking, and then recommend devices to help prevent falls and other accidents. A physical therapist will help you heal your injuries sustained along with your head injury while also help improving your movement and pain control of injured joints and muscles. During my car accident, I sustained a whiplash injury along with my head injury. Physical therapy helped control my pain, but it also helped with my balance. There are receptors in the neck muscles that tell your brain where your head is in the world. These receptors get damaged or torn during an injury to the neck. Your physical therapist can help these muscles heal and improve how these receptors work, allowing better communication between the neck and the brain. So your brain knows where your head is and helps you keep you better balanced. A physical medicine and rehab doctor, also known as a physiatrist. They specialize in injuries that affect the brain, spine, muscles, and joints. A PMR doctor can determine the extent of your head injury and assist with pain management and any other injuries you may have sustained. They can also refer you to other specialists as needed. Dizziness is difficult to diagnose and treat in patients with healthy brains, and even harder for patients with a head injury. Unfortunately, there's not much a general practitioner can do to help you. There are simply too many variables at play when it comes to the brain, and they're not trained to know all of them. This is why it's important to track your symptoms so you can communicate them to your family doctors so they can make a referral or recommendation to a specialist. Your sense of dizziness could be due to multiple systems not working well after your head injury. So it's reasonable that it may take multiple specialists to help you with your symptoms. With their guidance, they may be able to help you and your brain heal and you feel more steady on your feet.